Hello, my name is Maddie and this is Emma and we are your nurses today. We would just like to discuss your new diagnosis of myelodysplastic syndrome with you if you have a minute.
Yeah.
Great, okay. So if at any time you have questions for us, please don't hesitate to ask, okay?
Okay, actually I do have one. Do you know exactly what's happening to my body with the syndrome? I mean, the doctor briefly tried to explain it to me, but I'm having a hard time understanding it.
Yeah, we definitely understand that. So we'll try our best to give you this information in a way you can understand it easier. So to start off, myelodysplastic syndrome, often called MDS, occurs because of a problem with the stem cells that occur in your bone marrow. So the stem cells in your body eventually turn into multiple types of blood cells where they are functioning correctly. So in MDS, the stem cells are not working properly, and this causes a reduced number of all cells that the stem cells would normally turn into. So this usually includes your blood cells such as platelets, white blood cells, and red blood cells.
Okay, I understand. Do you know what causes me to get this?
Yeah, so unfortunately the cause is unknown. It has been shown that radiation or toxic chemicals can cause this, as well as smoking.
Oh, actually I smoke a pack of cigarettes a day. I didn't know this could cause it.
Okay, so smoking is a huge risk factor in the development of MDS and many other diseases. So with this being said, you really should consider quitting smoking or even just cutting back if you can. So is that something you'd be willing to consider?
Yeah, given the circumstances, I'm willing to make changes to better my overall health.
Great, okay, that's great to hear. So we can go over some resources for smoking cessation at the end of our visit today. Do you have any other questions in regards to MDS?
Yes, actually, I have noticed that the only difference in my overall health is that I have been very fatigued since my diagnosis. What are other signs and symptoms that are common with MDS?
Yeah, so other symptoms can include shortness of breath, unusual paleness, otherwise known as pallor, easy or unusual bleeding, pinpoint size red spots underneath the skin, and frequent infections due to the low white blood cell count that manifests in MDS.
Okay, good to know. I actually do have little red spots here on my left arm. Is that what you mean?
Yes, that's called petechiae, and it's caused due to bleeding underneath the skin.
Okay, what will the treatment options look like for me?
Well, unfortunately, there's no cure for MDS. The target treatment, however, includes management of the disease, which is intended to slow the disease process, ease your symptoms, and prevent complications.
Okay, I understand. Will this diagnosis have any other effects on my body?
So it'll mainly affect only your blood components. However, it will eventually lead to your immune system being less effective since MDS affects your white blood cells, which are essential to your immunity to stay healthy. Secondly, you might see a change in your mental health. Your body is changing, and this can affect how you view yourself. You also may have feelings of hopelessness due to there being no cure to your diagnosis. It is very important that you reach out to mental health services if you notice any of these changes. Your mental health does matter.
Okay, I will make sure to monitor how I'm feeling frequently.
Sounds great. So now we just want to inform you about some common exam techniques that will be used in your future appointments. So this is going to allow us to reassess your diagnosis and look for any new findings. So you'll normally have blood drawn so that your levels of blood components can be measured and compared to the past. Secondly, we'll assess your skin and any abnormalities that may occur, like bruising or more red spots. And a verbal assessment will also most likely be done to check in with how you're feeling and any questions or concerns you may have.
Okay, thank you for giving me this information so that I know what's to be expected.
Yeah, no problem. Do you have any other questions or concerns for us?
No, I don't believe so.
Sounds good. Okay, well, feel free to give us a call or reach out with any questions or concerns, okay?
All right, thank you.
Perfect,
Thank
thank you.
So these are styled questions. So for the first one, what body systems does MDS affect? So select all that apply. So we have A, pulmonary, so it does not affect the pulmonary system. B, immunity, it does affect your immune system because of the compromise in white blood cells, which help you gain immunity. C, blood, it does affect your blood because it only affects your blood compartments. And D, mental health, it does affect your mental health due to changes you'll see in your body. It'll cause you to feel hopeless and not like what you see overall. E, cardiac, it does not affect your cardiac system.
Okay, so next is the nurse is caring for a patient who is 65 years old with a platelet count of 7,000. result from MDS. While caring for her, she complains of a headache. What should the nurse's immediate action be? So A is administer acetaminophen per PRN orders. B, push a bolus of fluids as the patient is likely dehydrated. C, notify the provider. Or D, administer a cold compress. So the answer would be C, notify the provider. So a platelet count of less than 10,000 puts the client at risk for severe spontaneous bleeding. So the nurse should be aware of any signs such as headache, like she is showing here, irritability, restlessness, changes in vision, abdominal distension, or any signs of bleeding anywhere else. So the acetaminophen, you could administer acetaminophen, but it would not be the immediate action. She could likely be dehydrated, but again, would not be the immediate action. And then administer a cold compress would be nice for the holistic aspect, but it would not be the immediate action. So. All right, so I'll have you roll up your sleeves. We'll just take a look at your skin. Looks good. Have you noticed any changes at all in your skin?
Yeah, I've noticed the rashes have subsided a lot. It's
Yeah.
just a little bit of like bruising here and there, nothing like concerning.
Good, yeah, and I did notice the bruising, but yeah, your left arm is looking much better. Not so many pinpoint red spots, so that's good to see. And the bruising is gonna be a normal thing that you see, unfortunately. So just monitoring them will be important.
Okay.
But yeah, otherwise, how have you been feeling?
Mentally, I've had troubles in the beginning getting adjusted to like changes I've been seeing. I was really discouraged in the beginning.
Definitely.
I went online and reached out to other, like looked for community support and stuff like that, and connected with other people with the same syndrome. And it's good being able to speak with other people about this rather than feeling isolated and alone.
Definitely,
But
yeah.
mentally today I'm feeling great.
Good,
Honestly,
good to
seeing
hear.
improvement with my arm has definitely put me into the right direction with
Yeah.
the syndrome.
Well, good, that's great. I'm glad that you're, finding community resources and things like that. Do you have a good support system at home outside of like the community resources?
Yeah, I do. My family is very supportive. They do the best that they can.
Good to hear. So that pretty much is it. Unless you have any other, concerns or things you want to talk about.
No. Is there anything else I need to do as like a follow-up or?
Yeah, so we'll see you again in a few months. We'll have you schedule a follow-up at the front. And I am going to send you over to lab, and you'll just get your platelets, white blood cells, red blood cells, all that stuff drawn. And your results will be posted on your MyChart. And you can feel free to give us a call too if you have any questions about those results. But yeah, we're just going to continue to monitor everything, and just always feel free to give us a call if you have any questions about anything. So.
All right, thank you so much.
Yeah.
I'll also continue to monitor any changes that I
Yes.
see with myself
Yes,
as well.
that'll be great. Awesome.